on this computer. Here we go. Okay. So, if I can get my computer to advance. Come on, there we go. Most of you are already familiar with the Women's Fund of Rhode Island. We're a nonprofit organization. We've been around since the early 2000s. And we are a nonprofit that exists to invest in women and girls. And we do that through research, advocacy, grant making, and strategic partnerships, all with the goal of achieving gender equity through systemic change. The concept that we're presenting tonight of a giving circle hits both the grant making and the advocacy and the strategic partnerships. And again, we'll go into more detail about that in just a little bit, but it's important to know why it is that the Women's Fund is planning this particular giving circle. Now, what you see on the screen is the top 10 countries for how equitable women are compared to men in 156 developed countries around the world. So these are countries that, are somewhat like the United States in terms of how they have services and how they run their countries, that kind of thing. So the top 10, you can see on the screen, we've got a bunch of Nordic countries. We've got Rwanda and Namibia. We've got Ireland and Switzerland. Iceland makes the top spot, has for many, many years. But even in Iceland, women only are about 90% as equitable as men in that country. So still not quite even. Who's not listed? The United States. And would anybody like to hazard a guess as to where the United States ranks out of 156 countries? Petra's guessing 40 or 50. DJ is saying 50. Anyone on the line want to take a guess? Mary, are you going to guess? I can just see your, yeah, okay. So we actually rank 30, which when you compare the scores, it puts us at, if we were giving a grade, a school grade for the United States, we get a solid C. And the way that they measure this is based on economic security, health and survival, educational attainment, and political empowerment. And where we do really good is on the educational attainment. We're consistently at the sort of #1 ranking, although we've started to slip in the past couple of years, probably due to COVID. We do pretty well in economic participation. It's fairly easy for women to get jobs in the United States. However, and I'll go into this in a little bit, we do have that, gender wage and wealth gap that's persistent. Where we really start to slide is in political empowerment, and where we get a really, really, really bad score is in the health and survival score. More women in the United States die every day from reasons that could be prevented, particularly related to things like maternal morbidity, but also health diseases like heart disease and cancer, than in many other developed countries. So this is an area that is of real concern for the United States. Now, I mentioned that we have a gender wage and wealth gap in this country. Today, white women and women averaged altogether make about 84 cents to the white man's dollar. But when you start to break it out by racial characteristics, you start to see that Black women and Hispanic and Latina women make significantly less as you start to pare that out. And so not only is there a wage gap, but because there is that wage gap, it means that women are less likely to be able to save money. And so there is conversely a wealth gap. And because women live longer and they tend to take care of more people on their dollar, that means over time that we see a lot more poverty in women who are older as a result. And Vin probably knows that because he's been doing a lot of work with the AARP over the years. Now, I mentioned to you that health and survival is a real issue for women in the United States. This particular slide actually is hot off the press. It actually hasn't even been published yet in Rhode Island. It's on our new Women's Wellbeing Index that will be launched in a couple of weeks. And basically, it shows how maternal mortality in Rhode Island compares to other states throughout the United States. And you can see that we have still a fair number of deaths in Rhode Island that for many cases are considered preventable. And we can go into the details on that later, or potentially because we will be inviting some organizations that address maternal morbidity, they can talk about that as well in this giving circle. Now, we're here because this is an access to reproductive rights and freedom giving circle. And so certainly what happened in the spring that limits access for many women across the country to choose abortion care as their health care. I wanted to just take a minute and acknowledge the many reasons that women may choose abortion care. And many times it's not just because it's one reason, and overwhelmingly it tends to be financially related. That many times women feel that they can't care for the families that they have, let alone growing their families. But sometimes it's about bad timing. Sometimes it's about not feeling safe with a partner or feeling safe in general. Sometimes it's about the mother's health. And, going through a pregnancy might not be good for either her or her child, or both and. And so that's a really hard decision for some women to make. So here's just a laundry list of the myriad of different reasons that women might choose abortion care as health care. This particular map is updated as of September 26th, and it shows across the country where in red, in the darker colors, those are the most restrictive states for accessing abortion care. Even in Rhode Island, which we have some protections for abortion care, we're not the best state for access. And
Colorado.
sure. We are some restrictions and protections. So we're more the yellow. It shows black here,
Yeah.
but we're more yellow. Yeah. So in Rhode Island, first of all, we did codify Roe versus Wade in 2019. And what that means is that people can choose to get abortion care in Rhode Island based on the bullet points that you see on the screen. So as long as they're obtaining their abortion care before 24 to 26 weeks of viability, that is normal in Rhode Island. However, there are other restrictions that are in place. And I mentioned at the beginning of this meeting that the Women's Fund of Rhode Island participated in the Equality and Abortion Coverage Act lobbying last year, and we are going to do that again this year. That particular law, if it were passed, would allow people who are on Medicaid or state employee health insurance to be able to use their health insurance to access abortion care, which they cannot right now by law do in Rhode Island. So arguably, women who are on Medicaid tend to be low income women. They are the ones who are least likely to be able to pay for abortion care on their own, out of their own pocket. And we are not allowing them the right to do that in the state of Rhode Island. Also, we are not allowing state employees, regardless of their economic status. If they have state employee health insurance, they can't use it. There is also a real effort by pro-life groups to limit the ability of abortion care in Rhode Island. So they are looking to whittle away different pieces of the access as best that they can. So we continue to fight against that. Yes, Vin.
The restriction on public money
Mhm.
for abortions, is there a particular statute, or is it that prohibition annually included in the appropriations bill?
It is,
This is gonna be done how?
yeah, so it's a federal prohibition that if we were to change the law in Rhode Island, we could give that access.
Gotcha.
Yeah. Currently across the nation, if you are on Medicaid, you cannot use, you can't use state funded or federally funded health insurance to pay for abortion care. And the argument is, you can't use my taxpayer dollars to pay for something that I feel is ethically wrong.
That's a federal,
Yes. Federal
does
restriction.
that prevent the state from using state dollars?
No, but the state follows the federal restrictions right now. Yes, it's absolutely. Okay. So the thing that I will be emailing out to those of you online later tonight or tomorrow, and that is physically available in the room, is a new access to abortion care fact sheet for Rhode Island. And this is a research document, a policy brief that the Women's Fund of Rhode Island is, again, hot off the presses. We haven't officially released to the public yet, but we will be doing very shortly. And these are some of the highlights that are in that snapshot. So just in terms of basic information, in 2020, a little bit under 3,000 abortions were provided here in the state. There are only 2 abortion clinics in Rhode Island, and both of them are, I think they're both in Providence, which means that folks who are not, who have transportation issues to get to Providence are limited by that access. And you can just see the average of miles, again, for somebody who may be at a distance, how far it will take for them to be able to access abortion care. The average of 149 miles after 24 weeks means that they have to go out of state to get that abortion care. Yeah. So, all right. So that's sort of the background on access to reproductive health and freedom in Rhode Island. I will just note that reproductive justice also looks specifically at the issues around allowing particularly women of color to safely grow their families and parent them as they wish, as how they choose. And so when we think about the organizations that will be represented in this particular giving circle, we will be inviting groups that also are working specifically on Black maternal morbidity in the state, and who are also working on perhaps access for disabled parents to care for and parent their children as they wish, which there seems to be some restrictions based on what I have learned from these organizations. So it's more education to come specifically about some of these issues for those of you who choose to join the Giving Circle. Are there any questions about the general information that I've shared? Not about giving circles, but about the facts that I've shared tonight.
Do you have interaction with the minority health office and within the Department of Health? This is division.
Yeah, Vin is asking if we interact with the Department of Health and specifically, we haven't, but there's no reason that we could not. Yeah.
It appears from some initial interactions with her on the phone and their website that there really needs to be some outside inquiries and advocacy about what they're doing, what they're collecting, data, and so on. So it may be timely to develop a relationship there.
Thank you. That's good information to have. Yes. Any other comments, questions, thoughts? Okay. So at this point, I'm going to turn things over to Mary Beth. And Mary Beth, you tell me when it's time to run the video.
Okay, yeah, I thought I'd just spend a minute or two talking about, a giving circle and, what is it and why would we do it? And, the idea is that that collectively we can have more impact than we can as individuals. And, part of that is the obvious, financial impact on an organization, but also part of that is together, I think we can learn more, we can, educate ourselves, educate our friends, and, meet people who care about similar issues and enrich the conversation. And I think by enriching the conversation, and having different voices in the group, you get a real different perspective on the issue. And this is something that my experience with the Women's Fund grant committee really brought out. We had a really, just quite a diverse group of people who were talking about some of the organizations that had applied for the grants. And, I realized that when I'm thinking about, my own giving by myself, I only have my own perspective and my own reactions to what's going on. But when hearing other people's reactions and their, questions and concerns, you really can look at something in a different way. And so I found this a really rich way of contemplating issues and thinking about what kind of impact, I can have and we as a group can have. There's some structure around a giving circle and some decisions to be made about it. You need to decide how many people you want to have in the conversation and how much are they going to be each contributing, and how many organizations you're going to think about together, and then how are you going to decide. But those are the sort of technical points. And really, I think where the great part of the discussion comes in is thinking about what are our values and what are we trying to change about society, and how can we most effectively do that. I'll just pause there and see if anyone had any reactions before we start the video.
I'll just jump in really quick, if you don't mind, and say I'm going to have to jump off, but this is Ashley, and I've been part of several giving circles on a number of different topics related to climate change and a whole bunch of different things, and have just found them to be so powerful and just really echo what you say, that it's great to get different perspectives and then leverage other resources so you really can make bigger impact. So with that, I'll jump off. Nice to see you all.
Nice to meet you, Ashley.
Thanks, Ashley. Why don't we show the video?
A giving circle brings a group of people with shared values together to make social change. Individuals pool their time and money and decide together as a circle where the funds should go. Their efforts, discussions, and collective give transforms into community power, change, and civic action. Giving circles come in all shapes and sizes. They can be as small as a couple of people or as large as several hundreds. Giving circles can be local and community-based or national and international. Participants can be from similar backgrounds or from many different backgrounds. Giving circles make donations of any size, from a few dollars to hundreds of thousands. Giving circles support with their dollars, but also build awareness, volunteer, become board members, and more. There are 5 elements to every giving circle. First, you gather a group of friends, family, coworkers, and community members. Second, you discuss the vision and values that motivate you to give and see where there are commonalities within your group. Third, you pool your funds and decide which organization or project will receive your donation based on your values. Fourth, you give your pool donation and see your individual gift multiplied by the power of the group. lastly, you engage beyond your gift with your membership and with the organization, individual, or project you supported for amplified impact. Giving circles are a growing global movement of active circles around the world, giving intentionally, strategically, and thoughtfully.
Done.
Good afternoon, I'm Dr. Jones. I am chair of the Birmingham.
All right. Sorry, I didn't realize they were starting a second video there. Would you like to pick up again, Mary Beth?
To unmute. Can you hear me now?
Yes.
So I'm really benefiting from Kelly's slides here. I don't want to, I would give credit, or I do want to give credit where credit is due here, but why a giving circle? Why now? I think specifically why the giving circle for reproductive health and justice in Rhode Island comes from a need and a lack that's existing right now in philanthropy. And, fewer than 2% of organized philanthropy dollars are directed to women and girls. And as we've all just discussed, a really critical time period related to reproductive rights and health and freedom. And, we've talked a lot about, what are we able to do and what is a meaningful donation? And the fact is that grouping small donations can have a really huge impact. And so the goal of the Giving Circle now is to try to amplify our individual resources towards a problem that we all care about. And this is an interesting point that Kelly raises too in this slide, which is that, by collectively donating and amplifying smaller donations, we can change who gives, and by giving more people a voice in solution, it changes the outcomes, and it changes how organizations and lawmakers listen. So hopefully that was a clear statement of Kelly's excellent point. I can't advance the slides, Kelly.
Yep, I already moved it.
Oh, okay, here we go. So for this Giving Circle, the goal we had was to recruit at least 20 people who are excited about talking about this issue and learning about some organizations in the state that are doing good work. And they're also interested in committing at least $250 each. And if we have 20 people at $250 each, then we can raise $5,000 that will then be matched by the Women's Fund of Rhode Island. Now, that's not stopping anyone from giving more than $250, but the Women's Fund will match up to $5,000. The goal is to learn about 5 organizations in Rhode Island that are working in this space. And, the sort of executive team here talked about what is the right number of organizations to discuss. And 5 felt like the right number. These organizations, at this point in our new Giving Circle history are already organizations that are known to the Women's Fund. So there's some preliminary vetting that's been done. But each of them has been working in this space, and 5 seems like a manageable amount that we can discuss in a couple of meetings. The first meeting, we're going to learn about these different groups, either by presentations or by some fact sheets that we put together. And then we'll have another meeting to discuss, what did we learn from these folks? Where does it seem like the best place to prioritize the funding, and how do we want to distribute it? And then we'll go ahead in December and make those decisions, and put our spirit and dollars and energy into the world to help these organizations. So this is a next step slide. Kelly found this great site that helps organize Giving Circles. And so you can scan the code. And Kelly, are we sending this out to people, or should people?
Yes. Yeah, we will send this out just so that everybody has access to all the information. Yes.
Okay. Yeah. So this is a great site for collecting information, collecting money, and just acting as a general repository. So that's a housekeeping issue. And yeah, so I would say the first step, I would say, is probably the second bullet here, which is let's get people to join the circle. You know, invite your friends, invite your family, anyone who's interested in learning more, and willing to put a couple $100 towards the issue. And then we can share that QR code with them so that they can register on Grapevine. And then together we can meet on November 1st to hear some presentations. We'll do the same meeting format that we're doing this time, this hybrid format. So those of us who don't want to deal with the traffic are doing that. And those of us who can meet in person, I think it's actually lovely to see each other and have that extra little time to connect. And then the third meeting, this being the first, so now November 1st, and then December 5th, we'll get together and talk about what we've learned and make some final decisions. So it's not a heavy lift, but I think high reward.
Yeah. Thank you, Mary Beth. So there are actually 19 people total who indicated that they were interested in this information meeting. It is my hope that, those of us who are here tonight, that DJ's got 4 names that she wants to invite people with. So, essentially, I think we can meet our goal to raise at least $5,000 from 20 or more people in this giving circle for this year. This is an opportunity, again, to learn about some great work that's being done in Rhode Island, both by groups that you may already know or that may be completely new to you. And so the groups that we've invited to make presentations in November include Planned Parenthood, but also the Women Project, the Urban Perinatal Education Center, Sistafire, and the Women's Health and Education Fund. And each of them is doing really important work that addresses many of the issues that I had laid out for you in tonight's presentation. Are there questions about the Giving Circle, about the process, anything that I can help you with as you make a decision about whether you would like to join this Giving Circle at this time? Vin, did we answer your questions about what is a Giving Circle? Yeah, except that we're not necessarily working to elect people,
Right.
but we are, yeah.
Cause oriented.
Right.
Very intriguing. So initially, the group is looking to carry out a first phase or project between now and
In December. Right. So the idea again is to recruit 20 people who will each give at least $250. Collectively, that pool creates a pool of $5,000 or more that the Women's Fund will match up to $5,000. So we could potentially be making a significant gift to one or more organizations in this giving circle. So, and that will be determined by you all and your discussions after you hear the presentations. So the Grapevine website that had the QR code up on the screen actually has links to those organizations where you can learn a little bit more about them ahead of time. They will come here in November and do presentations about the work that they are engaged in, and you have an opportunity to ask them questions. In the December meeting, that's when the group comes together, only those who've donated to the pool, and decide where that money should be distributed. Yeah.
But is the investment tied to a particular work plan or objective, or is the Giving Circle just contributing to the general fund of the organization?
So that will be up to the organizations as how they present. They might present and say, we're working on a specific project, or we need general operating support. We would let the organizations determine that. Yeah. Good questions. Any other questions, Susan?
Yeah, thank you for all the background work you have done on this. It, like you say, it's not a huge lift and it seems very manageable. But a big impact to get done between now and December, which is really exciting. If I were to invite somebody and 250 is a little high for them, is that would $100 donation be acceptable, or are we really trying to get people who can do 250? That was one question. And
We are really trying to get the 20 people to do 250. It will be much harder to get, you know, a more, we want to hit that $5,000 sweet spot. So.
And Susan, just so you know, we talked a long time about what's the right balance there. And, you know, we were just trying to hit on a number that we didn't have, you know, it's hard to have 50 people giving $100 and then have a meaningful discussion. And so we were trying to create a balance between something that was affordable enough, but also, you know, would create a good discussion and yet still be, you know, a dollar amount that an organization is going to want to spend their time and come in and present to us. So it's a little bit of a balance. I'm not sure we're perfect there, but that's where we're trying this first go around.
okay, got it. And I think, Kelly, you answered my second question already, is that we could either donate all the funds to one organization or decide as a group to split the funds between.
Yeah, that will be
2 or
part of
more.
your group discussion. Yeah. And really as those of you who are here, who've been involved in the grant disbursement discussions from the Women's Fund perspective, I think you probably would concur that it's the meatiness of those discussions that help to really flesh out why and how we should make particular grants. In this case, it's not just Women's Fund money that is being given away. It's your money and we're matching it. So you get to choose. It's your choice, but you will have to come to agreement on it as a group. And that's another reason why, again, that smaller group may make it easier to do that. It's not just a vote. You know, it's a discussion, and let's figure out where we can make the most impact. Yes, Finn.
Are we precluded from considering a donor, maybe an elected or public official who has a campaign fund, they could write a check on their campaign account?
As long as we're not endorsing any candidates, that should not be an issue. Vin was asking if somebody who's running for office could make a contribution from their campaign fund. Or a current office holder, sure. I don't see an issue with that. It's a question of, you know, will they buy into the values of this giving circle and participate meaningfully? Yeah.
So in giving, is there an obligation then to participate as well in the deliberation and decision making?
So I know DJ was sort of whispering this on the side to me, and maybe it ties into what you're suggesting. Maybe somebody makes a gift that allows somebody else to step in who might not otherwise be able to meet the $250 threshold. So yeah, I mean, we're not simply looking for money. This is an opportunity for us to learn. And so if they're just making a donation without going through this process, they're missing out on the importance of why these giving circles exist. Yeah.
Good answer.
Was that what you were trying to say when I?
But also, I think we'd probably be willing to share whatever information we learn and you know, with a donor who's interested in this issue and, you know, doesn't have the time resources to attend the meetings, you know, we can share with them, hey, this is the discussion we had and this is what we decided. And, you know, if you'd like to piggyback a donation, we'd love to support that.
And just so when I invite people, I give them all
potentially.
the accurate information. The follow-up meetings are November 1st and December 5th. Is that correct?
Yes, that's
We
correct.
should try
That's
to commit
correct.
to those
And,
dates. And at 5:30 as well.
yes, at 5:30. And I promise we'll get the Zoom piece figured out ahead of time. And those of you who've been to this room now know the entrance is behind me. So, but we will make sure that there are clearer instructions going forward. I had asked DJ to share, she had a question or suggestion. And so I just want to be sure to give her some space as well.
Well, kind of piggybacking on what Susan said about someone who would very much be interested in this, but doesn't have the 250. I suggested that if there were enough that together they could give, like the 2 or 3 people that together could give the 250 and give a consensus amongst them as to the input.
They'd have one
That
vote,
might-
one
right,
vote
one
per
vote
250.
Right, exactly. So, but that would maybe is very passionate about the whole purpose of this, but doesn't have the funds. I'm thinking particularly, like, I know my daughter would say, this is important.
Mhm.
I went through this is really important, but I know that she would not have the 250.
Mhm.
Now, mom could give her the 250, but that
Mhm.
makes the whole point of if she could give 100 and somebody else could give 100 or 75 and
Yeah.
it came up to the 250.
I just wanted, this is our,
or hit the goal.
Yeah,
Right.
right.
And then anybody else can add to the giving pool without a vote.
Yeah, I want to say yes. And I also recognize that this is our first giving circle and I don't want to overcomplicate things. So why don't we continue the discussion, and that Petra and Mary Beth and I can maybe put our heads together and figure out if there's a lot of interest in building something like that. I don't want to outright say no. My instinct is like, let's not overcomplicate things. Yeah.
So obviously, that appears to me at least that by soliciting someone to put financial resources, you really want them to have more skin in the game by their participation.
Right.
And to build this, this body of people that will continue to advocate the interest and, so, but theoretically, I mean, you could get somebody that might want to only up $500 or $1,000.
Right.
This state, but that might provide the wiggle.
Yes.
For the other folks in order
Right.
to get to the table.
Right. And the one thing I'd want to be clear for is if somebody does make a wonderful, much larger gift, that their voice is not larger. They don't, yeah. Yeah. But yes.
I mean, is it appropriate to speculate that there might be a second circle? Oh, this concept, however it occurs and gets refined, will continue. You may have, I don't know, 3-4 of them a year or 2 a year.
For those of you who are on Zoom, can you hear the discussion in the room? I don't know if I need to repeat everybody's hearing it just fine. That's great. Yeah. So, if this is successful, we would definitely like to continue it. And this group will help us to think best through like what worked, what didn't work.
This is a project.
Yeah. So this is our first time doing this, and it's an experiment that we're excited about. Yeah. So yes, the idea is if it works, let's keep doing it, but let's tweak it. And it may be that this group says, yes, we want to continue on as the group that we've set up. We want to continue focusing on this issue, or maybe we want to explore different things, but that's a later discussion.
So, flyer or script that folks can use in doing this solicitation so that prospects, potential donors know what it is that.
Sure. Yes. We do have an information sheet that we've created, and also, the materials that we are recording and sharing tonight, will also be able to share out to people. So, and we would very much like your help in reaching out to people that you think might be interested. Any other questions or comments? All right, I think then, know that in the next day or so that I will reach out to all of you with the information that we've shared tonight that you can share out to others. I will also include the link to the Grapevine site, which is where it's the website, if you will, that where we will keep information for this particular giving circle. So we'll be posting things there, like the links to the organizations. If you want to take a look at them ahead of time, you can ask each other questions if you want to, or share information within that particular tool. That is also the tool that you will use to make your 250 or more donation. So you'll do that online. And if you have an issue doing something online, let me know and we'll figure out how to help make you part of that without necessarily having to do it through Grapevine. Great. If there are no other questions, I think, Petra, maybe we wait on whether we're going to rename the circle to a different date. And I'll just close by saying thank you so much for joining us tonight. I will also be sending out a list of upcoming events for the Women's Fund, which we'd love to have you join us for. For those of you who like golf, there is a golf tournament that is being planned by the Ladies Professional Golf Association for Sunday. Erin, what date is that? Sunday, October
16th.
16th. There's also Falvey Insurance is hosting Women at the Helm, which is an information day that I will be speaking at. So it's on the list of upcoming events, and you'll be able to click on different things. We've got a will planning workshop for those of you who need to get up to speed on your will. So lots of different things going on in the month of October, and we hope that you'll join us. Thank you so much. I will stop the recording and I will stay for a little bit if anybody has any additional questions, but otherwise everybody is free to go.